healthcare. Federal health officials with the Centers for Disease Control and Prevention report about a highly contagious virus called Norovirus that has some of the highest cases reported in the South and in the Midwest. And the CDC is also warning about increased cases of a drug-resistant bacterial infection that causes a stomach bug. For information about norovirus and about this bacterial infection, we talked with Dr. Krisiti Trussell at the Urgency Room.
Norovirus is a virus that causes diarrhea illness. It's spread either in contaminated food or from person to person. It's a virus that causes abdominal pain, nausea, vomiting, and diarrhea.
And you just mentioned some of those. Are those the main symptoms that you would see related to this?
Exactly.
So how do you know if you have it? How do you get tested for it?
Well, the vast majority of cases are characterized by vomiting and diarrhea. Most of the time, it's not actually necessary to test for the type of diarrhea a patient has unless they have low immune system, prolonged symptoms, really severe symptoms. A lot of the treatment for diarrhea is actually supportive care with hydration. So for example, sometimes we would give nausea medicine, and if the patient can then drink and keep themselves hydrated, that's a really important part of treatment for any diarrheal illness. Other people do require IV fluids and IV hydration if they're too dehydrated.
And that would be the main treatment that you would provide then, or?
Right. Norovirus doesn't have any specific medication that's used to treat it. The body has to fight it off, but in the meantime, it's really important to provide good supportive care. For example, Tylenol for fever control, drinking plenty of fluids, and making sure that you stay up on your hydration are the main things.
And would those also be the same advice to protect you and your family from getting or contracting the norovirus?
So norovirus is spread from can be spread either through contaminated food or from person to person. If someone is sick with a stomach bug, it's, good hand washing is really important, but also avoiding preparing food for others until you're feeling better in a couple of days after that.
Great advice. Anything else that you can tell us about the norovirus? Otherwise, we're also being told about a bacterial infection stomach bug called shigellosis. What should people know about this?
Yeah, Shigella is a little bit different. Shigella is a bacterial cause of diarrhea. It causes similar symptoms, but they can be, more severe than norovirus. Fever, abdominal pain, nausea, vomiting, diarrhea are common. Some people do get a more severe infection and get bloody diarrhea and more severe symptoms from shigellosis. A lot of the mainstays of treatment are the same. So symptom control with medicines for fever and medicines for nausea to help maintain hydration. People with weakened immune systems are at risk of more severe symptoms and infection, and sometimes can even end up in the hospital. Shigella is tested for with a stool sample, and some people do need antibiotics to help the Shigella bacteria pass.
So how can the urgency room help someone that may have these symptoms and either the virus or the bacterial infection?
Well, we certainly see a lot of patients for abdominal pain with or without nausea, vomiting, diarrhea. We can provide full evaluation for abdominal pain, including ultrasound or CT if necessary. We can provide medications and IV fluids for dehydration and symptom control.
The main thing is if you do have it, make sure that you're treating it as well as you can with the fluids and all of that.
Keeping really well hydrated is the key. And if you're worried, at all, we'd be happy to evaluate you.
Well, Dr. Krisiti Trussell, thank you as always for your time. We really appreciate it. Good advice.
Thank you for having me.
Get it, slip it, cuff it, check it. Talk to doctor now and share it.
Get it, slip it, Cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
A new state report finds that the 988 mental health crisis hotline is helping save lives. More than 30,000 have called, text, or chatted messages seeking emergency help through that 24-hour hotline since it first started in last July. Also, the Minnesota Department of Health just released a new online report that shows what are the most common causes of violent deaths in our state, including death by suicide. For information about what the new data reveals about all violent deaths in Minnesota, as well as what you can do to prevent them, we talk with the Minnesota Department of Health.
We're the Minnesota portion of the National Violent Death Reporting System. And it ranges everything from information that's found on typical death certificates, like the date that the person died, the manner of their death, what caused the injury, for example. And then we also look at things that are a little more detailed, like toxicology results for each individual, circumstances surrounding and leading up to their death, such as whether or not they had a mental health problem, whether or not they left a suicide note in cases of suicide, and if there was a homicide, what is the relationship between the victim and the suspect in that homicide? And so the Violent Death Reporting System captures data on suicide, homicide, unintentional firearm deaths, law enforcement intervention, and undetermined deaths that may have been violent in nature. So that's a broad overview of what is in the dashboard.
So there was a lot of information in there, a lot of data. Maybe let's start with suicides. What have we learned about suicide deaths here in Minnesota?
Well, so there's quite a bit of information historically from death certificates. And so we know that suicides have been increasing for 20 years or so in Minnesota. Every now and then we get a year where it goes down, but generally speaking, they've been on the increase, on the rise. And so we have lots of information from death certificates so that we know things like the patterns by sex and race and ethnicity, age group, what the cause of the injury was, whether it was firearms or suffocation, for example. But what this adds for that is, like I said, those circumstances. And so, one of the things that kind of, it didn't necessarily surprise us, but it sort of confirmed what we had seen in other studies, where less than 40% of suicide decedents leave a suicide note. And that's important to know because it points out, that scene investigation is very, very important. So the work that the medical examiners and law enforcement do to investigate the scene to make sure that they're attributing the proper manner of death for the individual. But it also lets us understand that there may not be that sort of, or I should say, it dispels a potentially common myth that there's always this note laying out exactly why the person did what they did, so that people can have a little bit of closure. That's not always the case. And so we're looking for other ways in those circumstances to try and identify risk factors and ways that communities can use this data to intervene or create interventions to prevent suicide.
As far as some of the suicides, what percentage were involved with firearms? What were involved with antidepressants, things like that? What were some of the data that you found?
Yeah, so in any given year, it varies a little bit in terms of the percentage that are by firearm. Typically, it's between 45 and 50% of the suicide deaths occur. The injury that causes their death is firearm related. About 25% or so are from suffocation, and then there's about 10 or 15% in addition to that are the poisonings like the opioids that we hear quite a bit about. So those are really the three most common. They make up about 90% in a given year of the suicide deaths in Minnesota. That's different from state to state, but in Minnesota, that's what the patterns tend to be.
And there was also a difference between men and women in suicides as well. Interesting data there too.
Right. So what I've found in the few years that I've been focusing on suicide epidemiology is that depending on the population you're looking at, the epidemiology can be very different. So Males, it's a little bit more likely to be firearms. Females, it's a little bit more likely to be the suffocations and poisonings. That's different by racial groups and age groups as well. And so that's one of the items that we hope this dashboard will let people see is they can look and filter by the population that they're most interested in, the population that they work with, and see what are some of those leading circumstances. Do they have mental health issues more commonly? Do they leave suicide notes for some reason? Do they have a history of past suicide attempts? These are things that can help identify increased risk for suicide and hopefully identify interventions to prevent suicide in the future.
Especially on the mental health issues. We've heard so much about that, and that really comes out in this data as well, what role it's playing in a lot of these, not only suicides, but homicides as well.
Right. So the two leading circumstances, the most common circumstances that we find in the medical examiner reports are that the victim had a current mental health problem or a history of mental illness treatment. So that suggests that there is some opportunity for intervention to prevent suicide in mental health facilities, mental health interventions that might catch some of those folks who would otherwise end up as suicide decedents.
Anything else that was surprising by the data that you found or that really stood out in your mind?
I mean, I look at the data all the time, and so it's, I'm not arrogant enough to think that nothing surprises me, but it's hard to look back and say I was surprised at a certain time because I've gotten used to it. One of the things that I was a little surprised by was the size of the difference in the toxicology results between males and females. So the most common substance that was found in the systems of people who die by suicide was alcohol, and that's about 30% for both males and females, give or take a few percentage points. Antidepressants, however, were much more common in females than in males. And in hindsight, that makes a lot of sense because we know that males tend to avoid the healthcare system. And if you don't access the healthcare system, you're less likely to get antidepressants. And so, but it was the size of the difference that surprised me, not so much the fact that there was a difference where females had a much higher rate of antidepressants in their system at the time they died than males. And again, I think that's, correlates a little bit with the mental illness treatment and suggests possible interventions where if they're getting prescriptions filled for certain medications, there can be extra messaging about suicide prevention, for example.
And what would be some of the other interesting data having to do with homicides as well as also other causes of homicides and things like that really stood out?
Right. So I think the thing that I like to highlight the most about the homicide data is that it's been increasing. It started increasing before the pandemic. I think there was plenty of reporting and recognition that the pandemic, as well as George Floyd's murder, were associated with an increase in homicides that summer in particular. And in 2021, I think we saw lots of news reports, and we'll see that public health data confirming those news reports coming out soon that homicides continue to increase. So that's something that I think is displayed here, but isn't necessarily a surprise. What may be surprising to people, and that I like to also highlight, is the nature of the relationship between the victim and the suspect. And so what we found is the largest proportion across the board of all homicides, there is some known relationship between the victim and the suspect. These are not, the majority of the time, they're not strangers that are committing the homicide and the victim, the relationship between the suspect and the victim. They're not necessarily random. There is some relationship there. That's particularly true when you look at the female decedents, where somewhere in the ballpark of 40% of the suspects in those cases are current or former intimate partners. And again, it's not to say that it's surprising that intimate partner violence is a problem. We know that. It's been established for years. But I think the size of that problem, the percentage, and again, the difference between the males and the females might be a little bit surprising to people. And I think is important for people to know.
And anything about firearms in particular, how that data has changed or increased or reduced? Or...
Sure. So the one thing that I do like to point out first about homicides, or not homicides, about firearms, and see, I even made the association in my head too, even though I live with this data all the time, that the large majority of firearm deaths in Minnesota are not homicides, they're suicides. On a year-to-year basis, that is between 65 and 75% of the firearm deaths are suicides. The other 30 to 35% are homicides. So they make up, virtually 100%. There are very few unintentional homicide deaths, which is a relatively good thing. But that's the first thing that I like to point out about the firearm deaths. But by virtue of the fact that suicides have been increasing, and especially in recent years, homicides have been increasing, firearm deaths overall have been increasing pretty rapidly. So that's something else that I think this dashboard can help.
I'm Chris Jakimick. I served in the United States Air Force and I deployed 3 times. So in 2017, I was serving as an Air Force First Sergeant. Our motto in that role is my job is people, everyone is my business. But unfortunately in that year, I would lose my own brother, Lance Corporal Adam Jakimick, to suicide. The majority of veteran suicides are from guns. I store my weapons securely, not only for myself, but for my family. My service never stops.
Now, in our 18th year of Inside Healthcare, we take a look back through the archives to 4 years ago this month when we had the pleasure to meet a remarkable young man and his mom who wrote a book about raising her son who was born with a rare neurological disorder. Once again, here is Randy Rust and his mom, Cindy. Welcome back to Inside Healthcare, and joining us now, we're very pleased to have with us Randy Rust and his mother, Cynthia, or Cindy, and she's written a book. It's called It's Nice to Meet Me Too, and it's all about Randy and raising a son with a rare neurological disease called TS. So it's so nice to meet you, Randy.
Yeah.
Glad to have you with us.
Yeah.
And you too, Cindy. So,
Thank you.
First of all, why don't you tell us what TS is? What's it all about?
TS is tuberous sclerosis, and if you have the disease, it's autosomal dominant genetic disease, so 50-50. There is gene markers for it now on the TSC1 gene, TSC2, so you can be tested. But then there's a big percentage that is sporadic mutation as well. So it just occurs, and it can be on a spectrum. You can be very affected with seizures, which actually can cause the mental retardation with the amount of seizure activity as a baby, called infantile spasms. And otherwise, if you are past the age of 2 and haven't had a seizure, you oftentimes are functioning very normal. And I have friends that are doctors at NIH and lawyers and very successful people.
Yep.
Yeah, with tuberous sclerosis. So it runs the spectrum.
And Randy, can you tell us how old you are?
24,
40.
45.
No, 40.
Not
40.
45.
No, you're not that old yet. 40.
40.
40.
That's awesome. And you had a big party for your birthday?
Yeah.
You had a big 40th birthday party. Can you tell her where it was? Can you tell Jody where it was?
At Uncle Harry's house.
No, it was at Shamrocks.
It was at Shamrocks.
Oh, at Shamrocks.
Yes, and Randy used to work there.
Oh, okay.
Yes, and he had a 30th surprise birthday party there too.
Nice.
But every party's a surprise for Randy. so-
Shamrocks broke, Mom.
No, he just doesn't work there any longer.
Right. And every birthday is special, but especially for Randy. I mean,
Right.
you were told that he probably wouldn't even live to be 20.
That's correct. Right.
So you actually call him your miracle.
Right.
Yeah.
Yes. He is a miracle. He's outlived most of anything ever and had many, many, many surgeries. One collapsed on an airplane due to tuberous sclerosis. He's had partial nephrectomies of his kidneys, both kidneys. The tumors grow. That's what happens with tuberous sclerosis. Usually they're benign tumors, but they grow in the organs, such as kidneys, lungs, heart, and the brain.
And you just never thought you would live to see him be 40?
We never did, and it's
and
been
40
wonderful.
plus now,
yes,
right? Yeah.
Yes.
And not quite
Yes.
44 yet, though.
Yes.
Yeah.
And it was due to primarily getting in a study out of Cincinnati Children's Hospital with Dr. Bisler, and the drug was Afinitor or rhabdomycin, which was actually a drug used for kidney
They get
transplants.
a new hospital.
But they used it, and it's really helping these kids.
They
It's
get a bar thing.
shrinking and holding the tumors at bay in the organs.
Wow.
And he really has done very well with no seizures, actually one little one, but no seizures in 10 years to speak of.
That's
They don't want a
fantastic.
broken hospital.
Yes, no broken hospitals, no.
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 And he has some favorite hospitals or rooms at favorite hospitals. I
Yes, tell her
understand?
what you like to look at down at Children's and United. What do you want to look at? Cathedral?
Cathedrals.
Yeah,
Yeah,
he
it's
likes,
beautiful.
Yeah, he wants
The
a
cathedral broke.
view of the cathedral, right?
It broke, Mom.
Yeah. So
The
Yeah.
cathedral got all broken.
everything's old and broken.
Oh,
It
yeah,
just-
it is old. Yeah.
Well, that's what he says.
Yeah.
And, yeah. So.
So, why did you decide to write a book?
Well, like any parent, you want to share stories about your children. And my stories began when I was teaching high school, and I found that I could keep students' interest better than actually the subject I was trying to teach with my Randy stories. And over, the stories became an oral tradition. People would ask for Randy stories, not only at school, but friends and relatives and being out in the community. And then people started to say, you should really write a book, you should write a book. And I had been journaling these stories for a number of years, and my daughters, who are both very, very creative as well, and they journaled, and teachers had journaled, nurses had journaled. So the journal added up, and the book got written, and it was a dream to get it published.
You know, and reading the book, you know, he's had tremendous challenges in life, but you try to find the humor
Right.
in a lot, and he's
Right.
actually pretty funny.
Yeah, he's very funny, and
Yeah.
that's his story. It's
Can I earn my chocolate donut?
you're earning the chocolate donut after we're done with the
Can I
interview.
drink my water?
Sure can.
Yeah, I heard Randy likes donuts, so I brought donuts for him today.
That was so kind. He loves donuts, and Granny Donuts on Robert Street. He's been going there since he opened. So yes, but
broke.
yes, Randy, it did break.
So, how about just very quickly, one little quick story about from the Randy
From the-
story? Yeah.
From the book?
Yeah.
Well, two kind of stand out. The first one is whenever the girls had college friends or high school friends
He's
up.
got two younger sisters.
Correct. Over to visit. They were getting ready one night, a bunch of the college girls to go out, and Randy was up there, and of course the perfumes were going, the hairsprays were going, and the smells, and Randy loves smells too. And he came in and he started telling each girl what they smelled like. So then they lined up. They wanted to all know what they smelled like. And one smelled like roses, another one smelled like, shampoo, another one smelled like,
Can I look at these?
yes, like donuts.
Go ahead.
And then he came upon the last one and he said, and you smell pregnant. And which was irrelevant to anything anyone had said.
Interesting.
And another thing, and he's not trying to be funny. It's just,
It's a wise story.
it's just, but the other story that we really like is he went to summer camp at Camp Friendship, and he got in the car after being there for a week, and he told us he had done such a great job. 2 thumbs up, and we were reading the review on the way home, and it said that he had tipped over a wheelchair, and I thought, well, that's not too bad. But then a client had been in the wheelchair at the square dance, and he wanted to sit down. So, I mean, these stories aren't really funny, but they're funny.
They're heartwarming.
Right. He doesn't
Absolutely.
mean any harm. He's a very sensitive, loving boy. But yeah, and he. And my favorite is we're going through an intersection, and the light was turning yellow, and I said, all right, Randy, we're going to go fast, so hang on to your hat. And he whipped his seatbelt off, and he whipped to the back seat, and he said, I can't find my hat. He never had a hat on. So very literal too.
Yeah.
So,
So,
yes.
and I understand too that some of the portion of the proceeds from the book have gone for TS Alliance for
Right,
research
right,
and things. So you're
right.
helping other families.
It's
as
an
well.
organization that's, it began in 1974 in some mother's kitchen in California. So it's grown to worldwide, and Congress actually enacted $6 million for research. So we are
That's awesome.
learning so much
Yeah.
and doing so much, and there's so many studies, and so many children are being helped, even by this drug that Randy's the oldest on the drug. So
Wow,
yeah,
good for you.
one of the oldest.
So, and then Randy, I understand that you're the fun uncle with your 5 nieces and nephews. What are some of their names of your nieces and
Randy,
nephews?
can you tell who's this?
Maybe
Baby West.
Maybe West. Maybe Brady. Maybe Samantha. Maybe Evelyn. Maybe Greta.
They look like they adore their uncle.
And
Randy.
note that they are
Look
9,
at the phone. Go ahead.
5, 4, 3, and 2, but the baby's still attached to the initial name because he
They're
learned it
always
that way.
fans
They'll
of
always be baby.
So if anyone's interested in the book, and you were saying that you'd be interested in coming to talk to book clubs.
Oh, and I
things
love
like
book
that?
clubs. That's, again, like the oral tradition. I'm able to go and speak, and people are able to ask questions and learn, and people are very interested in how it was raising a handicapped child and learning more about tuberous sclerosis.
And he's looking at, Randy and your family are featured in Mendota Heights Living magazine for March, so it's nice to share your story with them as well.
Thank you.
Any final comments that you want to leave with our viewers about Randy and about your story?
No, just humor is what's gotten our family through so many difficult situations. So we laugh and we enjoy life with Randy, and each day's been an added blessing
broke
for us.
wheels.
So thank you for
Oh, no.
having us
Thank
and
you so
having
much
Randy.
for your time.
Yeah.
And Randy, thank you for coming on the show. We really appreciate it.
Yeah.
And I think you've earned a donut.
What do you say?
Thank you.
You're welcome.
right.
Thank you so much. Our thanks to Randy and Cindy Rust for sharing their story with us. Well, that's our program for you. Join us again next time on Inside Healthcare when we talk with a local doctor about the very latest on spring allergies. See you then, everyone.